I'm Pat Murphy-Stark. Welcome to MDTV Medical News Now, a program dedicated to bringing you leaders in the field of healthcare. Our show strives to give you the latest information about new techniques and treatments in the field of medicine. In the time prior to breast implants, plastic surgeons were often called upon to provide solutions for breast deformities, perhaps resulting from birth abnormalities or from the treatment of cancer. From this experience grew a much better understanding of breast surgery in general. Plastic surgeons developed techniques and materials that served to enhance the appearance of breasts that were perhaps small, sagging, or of different sizes, but otherwise normal. Today, breast augmentation is the third most requested cosmetic procedure, following liposuction and facial procedures. Determining placement of the implant leaves two choices, either on top or below the chest muscle. Each has its own advantages. Placement above muscle gives the breast a more natural appearance, since this is where natural breast tissue is located. Placement below the muscle provides a layer of camouflage, hiding any rippling that may occur on the surface of the implant. Factors that determine the best placement include age, lifestyle, and body type. The ideal candidate for breast augmentation is mature, healthy, and realistic in her expectations. Doctors stress that it is important for candidates to want to improve their look rather than hoping for the perfect figure. Among women who have had breast augmentation, the satisfaction rate is very high. Technology plays a significant role during the breast augmentation procedure itself. As medical reporter Sean Doran tells us, advancements in the tools of the plastic surgeon contribute the best possible result. That's the focus of today's MDTV Medical Moment.
Breakthroughs in the miniaturization of computers for the NASA space program had an impact in areas that far exceeded that of space travel. The same can be said for breakthroughs in the field of medicine. New technology often finds uses in areas different from that for which it was originally intended.
A perfect example is the endoscope. The endoscope can be accurately described as a tiny tube containing light-conducting glass-like fibers. The purpose of the endoscope is to allow doctors to see inside the human body for surgical procedures without the need for a large incision. Endoscopes have been used for procedures including those of the knee and other joints, the gallbladder, throat, nose, and colon. Today, the endoscope is finding its place in cosmetic procedures as well. Some of these applications include procedures of the forehead, face, abdomen, and breasts. Although the purpose of using the endoscope still remains to allow the doctor to see what he or she is doing during the surgery, there is an indirect benefit that ties in quite naturally with cosmetic medicine. Of course, that is the minimization of scarring made possible by smaller incisions. Also, doctors are able to make incisions in areas that are hidden and several inches away from the area being operated on for insertion of the endoscope. If you would like to know more about endoscopic plastic surgery and other cosmetic procedures, the board-certified plastic surgeon is your best resource.
I'm Sean Doran reporting for Medical News Now, and this has been your MDTV Medical Moment. Any questions or comments, please call toll-free 1-877-MDTV-NOW. That is 1-877-638-8669.
We've just seen how the endoscope helps to minimize scarring in the breast augmentation procedure. To talk more on that subject is our guest, Dr. Zachary Gerut, a board-certified plastic surgeon from New York. Dr. Gerut dedicates his practice to cosmetic procedures, including the no visible scar breast augmentation. Welcome to the show, Doctor.
Pleasure to be here, Pat. Thank you.
Well, you've obviously addressed one of the main concerns that women have is they don't want to have scars. What other types of things should they be concerned about to get the safest and the best possible results?
Well, patients should always be sure that their surgeon that they intend to have do the surgery is a board-certified surgeon, and this can be checked on easily with various organizational phone numbers. It's important to know that if your surgery is going to be done in a doctor's office, the doctor should have privileges to do this operation in the hospital. Other than that, patients should inquire about anesthesia because it's important to know who is going to be giving you that critical medication during the operation, as well as who makes the implant they're going to receive. Patients should be given a card that has all the information about their implants on it by their surgeon. In addition, the patient should have some knowledge of the surgeon through a referral by another physician or perhaps by friends or relatives who've used this surgeon in the past.
What would you say is the best route for inserting the implants? Because I know I've heard of many different options of getting it in there.
Well, each doctor has his or her own preference. My priorities when choosing the incision are based upon the patient's individual anatomy. Of course, if there are any scars present on the breast or around the breast before my surgery. There are other procedures that can be done in conjunction with breast implant surgery that offer access to the pocket that you need to put the implant into. But most importantly, for a patient who's never had surgery of the breast, there are 4 possibilities: under the breast, around the nipple, under the arm, and through the belly button. My preference is under the arm because it involves placing absolutely no scar on the breast, but I have the ability to place the breast implant under the muscle, which I believe to be the better position for it, as well as to control the operation endoscopically so that I can see everything that I'm doing, controlling the bleeding as well as the surgery as it progresses.
How about the size of the implant? Because I know there's a whole array of sizes out there. How do you determine it? What you should go with? Is it the person's choice that's coming to you that says, I want A, B, C, D, etc., or do you have to really take into consideration a lot of other things like their body type and if it would look proper or not?
Absolutely. Many things have to be taken into consideration. One of the most important things patients should understand is it's not possible for them to choose a letter. If you took a 32 brassiere, 32C for example, and a 36C brassiere, those 2 cups would be completely different. So if a patient shows a surgeon in a picture of what they want their breast to look like, that does not necessarily have anything to do with the patient's result because the body shape and size can be completely different, and therefore it's an irrelevant piece of information. I prefer that if my patients have been pregnant in the past and they've had an enlargement of their breasts, they can use that as a guide as to what they'd like to have because they had it once and perhaps would like it back. Patients who've never experienced that can choose a size based upon inserting items into their bra and show me exactly what size they'd like to be.
How long do they last? That's something I've always wondered.
Well, patients have an idea that the breast implants will last forever. Unfortunately, because it's a man-made and therefore imperfect by nature device, it's not going to last forever. Most patients understand, because they've been told and should be told, that the breast implants, by virtue of the manufacturer's specifications, are thought to last 20 years. Somewhere around 20 years after their surgery, the patient should expect to have to replace the implants. This may seem like something that is distasteful. However, if patients just stop to think, let's see, it'll be the year 2019 before I need to switch, you can put that into perspective. It's not an overburdening responsibility to know that for your future. Besides that, 20 years from now, there'll be much better breast implants available, feeling better, as well as more durable, and most patients will want to switch.
Now, I understand that you brought some before and after shots with you. Could we take a look at those?
Absolutely. This is a typical example of a patient of mine who's had breast implant surgery. On the before picture, you can see someone who has small breasts, tight skin, there's no drooping of the breast. And in the after picture, it's a larger breast, larger as per the specifications of the patient, with obviously no visible scar whatsoever on the breast.
Before we go to break, if you would like more information about breast augmentation or related procedures, you can reach Dr. Gerut's New York-based offices at 1-516-295-2100.